Welcome to another episode of Question of the Day. Hello, Dr. Dell.
Hi.
Okay, 100-meter sprinter suddenly stops immediately after crossing the finish line and subsequently develops syncope and collapses. What is the most likely physiological mechanism responsible for this event?
Okay. So we are looking at a 100-meter sprinter who, after finishing the race, suddenly came to a halt and had syncope and collapse. Yeah, that's what the question is saying. So what happens is that during a 100-meter sprint with an abrupt ending, the venous return to the heart will reduce, because when the sprinter is running or is sprinting, what happens is that the muscles in the calf, they are going to be contracting, squeezing on the veins to improve venous return to the heart. Now, when the sprinter comes to a sudden halt, that contractility of the muscles around the veins will suddenly reduce, and that would impair venous return. When venous return is reduced, the blood reaching the lungs and returning to the left ventricle at the end of diastole, that is the preload, will also reduce. And using the Frank Stalin's law of the heart, which states that stroke volume is directly proportional to the preload, once preload is reduced, the stroke volume will also reduce. The cardiac output will reduce, meaning that blood supply to the heart, the brain especially, would also reduce. Once there's cerebral hypoperfusion, that will result in syncope with a subsequent collapse.
Very, very insightful as usual. Thank you. Peace out.